You've been staying healthy during the whole pandemic. Be honest. Mm, Not easy, is it? It feels like staying healthy could be a full-time job. Well, listen, our next guest has the ability to help us with P3 Medical Group be our healthiest selves. So, yeah, we might not have been doing the right thing over the past several months, but it doesn't mean we can't start right now.
That's the beautiful thing. You always get a second chance to be healthy. Milo Brantner is here. She's a doctor of nursing practice with P3 Health Partners right here in Nevada. Milo, welcome to the show.
Hi, yes, thank you for having me today, guys.
Absolutely. Yeah, we're thrilled to have you. You've got a very cool headset. You look like Madonna right now. So we're off to a good start. Like Sean said, health is critical always, but during this whole 2020, it's just more pressure than ever to really, look inside and make sure you're taking care of everything. What advice have you been giving to people this year in particular as they manage their health?
Well, I think the most important thing is that you want to schedule an appointment with your primary care doctor. If you don't have one, it's probably a good time to look for one that you connect well with because during these visits, where we call it wellness visit, it really helps you form some healthy habits so that it can continue to help promote some overall long-term health benefits for you. So it's important to at least take that first step is to find a healthcare provider and make an appointment with them.
Absolutely. Don't be afraid to make that move and maybe hear something you don't want to hear, or at least get you on the right path. Speaking of get on the right path, seems like some people, they want to get on a diet that'll be better for them, or maybe they'll take some supplements and kind of help them along. What do you say
Mm.
before anyone takes on a diet or some supplements and adds that to the regimen?
I would say the first step is really discussing the type of supplements and vitamins that you want to add to your regimen, talking to your healthcare provider about it or your local pharmacist, because there are some potential side effects or interactions from those supplements that you may not be aware of. For example, some of them can actually increase the potential side effects of certain medication, or it may decrease the effectiveness of your current prescription medication if you're on medications right now.
Mhm.
I love that you're reminding folks about this because honestly, sometimes you take something as simple as an aspirin and you think, oh, it's just an aspirin. It's not going to interact with other things that I'm taking. But in fact, there are some concerns when it comes to those basic over the counter medications like aspirin and even allergy medicine.
Yes, absolutely. Our everyday medication, like an aspirin or decongestants or allergy medication, can definitely cause some issues. Some of the most common things are it actually increases your bleeding factor as well.
Hmm. Wow. Right now, I know a lot of people are they're thinking about their health plans. We're in the middle of a Medicare open enrollment, and then you have the Affordable Care Act open enrollment that's happening soon as well. Why is now such an important time for people that are looking at their healthcare plan?
It's a very important time because this is the time where you actually get to pick and choose a different plan if you find that in the last year, the current plan you have is just not meeting your needs. So if you are Medicare eligible for the first time, you can either stay with that plan, or if you find that they don't have the benefits that meet your needs, you can switch to a Medicare Advantage plans. And there are a lot of those out there. They offer various different specific benefits that are different from each other. So you want to look at it because if you're already on a Medicare Advantage plan now that you feel is not meeting your needs, then you can certainly look at a different plan as well
Mhm.
because you may be missing out on some benefits such as transportation service, pet sitting, dental, vision plans, and even lower prescription costs as well. So there's a lot of things to look into.
Did I hear pet
Did you say
sitting?
pet sitting?
Yes, some plans actually have that because they feel that if your pet is your family member and if you can't go to
Oh,
the doctors because no one's watching your pet, you're
Oh,
not going to go see your doctor. So they actually offer that,
how great is that? I love it.
I love this.
right?
Listen, I've heard of them covering gym memberships as well. I'm telling you, if you have a
Yes,
gym membership and a pet, chances are you are living a healthier lifestyle. So, yeah, Sean and I are on board for
absolutely.
this.
I love it.
Milo, before we go, it's been so fun having you on. We remember when P3 came here in the Valley. We know it's a physician led healthcare group. Explain to folks what that means and kind of what you feel the spirit is behind P3.
Yeah, so at P3, we really try to give the care that patient deserve, and we have, a large amount of supportive care staff that help all of us clinician to provide that care for our patients. We have a total of 30 primary care providers throughout the valley in 9 clinics. One of the clinic is actually out in Pahrump, and then we're also contracted with an extensive network of affiliate primary care providers as well that may be closer to your home. And then we also have contract with extended specialists like cardiologists, oncologists, you name it. We have contract with them. So it's just a really huge network, all in one big package, trying to really provide the care that our patient deserve.
Awesome. Well, we have a lot of new people moving into the valley that are in need of some care. So now that they know, they can go to
Yeah.
CP3. It's great to have you. Thank you so much, Milo.
Good to talk to you today.
Thank you.
All
Thank
right.
you. Nice to see you guys again.
Nice to see you.
Absolutely.
P3NV.org if you want to learn more. You can also give them a call at 702-333-4700. P3 Health Partners Nevada, a proud sponsor of the Morning Blend.